on my drop-down list.
Oh, hello. Can you hear me?
Yes.
I'm a GP in Ullapool too. Sorry, I was just having a few technical issues in a different room to usual, but yeah.
Great, we've got two Alices I've just noticed as well. So then, so that's Alice Scriven. Thank you for coming. And we've got Alice Miketon. Is that how I say your surname?
Oh,
yeah, that's correct. Yeah. Pretty good. Yeah. Hi everyone. Hiya.
And then I've got Anna.
Yeah, hi, that's me. Hi.
Great. Nice to see you. It'd be nice to know what your interest is in this, or if you have a role in the community, or if it's just a general interest. That'd be nice to know.
So yeah, I work for Children's Services, and I work in the schools and in the community, but I have a background in outdoor learning for many, many years. So that's why I'm coming along from a professional, but also it's an interest and I really believe in it, very passionate about it. So
great. Yeah. Thank you. Christine.
Hi, I'm Christine Crook. I am a director at the Lochbroom and Ullapool Community Trust. I'm also the College Centre Manager at UHI North Western Hebrides in Ullapool. And on a personal level, I just think that green health is so important. And, you know, I'm quite interested myself. I like going out and walking and cycling and running at times. And yeah, that's, you know, I've got a personal interest and a job and community trust interest.
Thank you. Next, we've got Claire.
Hi, I'm Claire. I'm Claire Cayley. I'm the priest at St Mary's Church, and we're in what's called an eco-congregation. So we have an interest in the natural world and how we relate to it, and I suppose from the well-being point of view, I suppose professionally, spiritual well-being, but myself also interested in being outdoors and learning and enjoying and feeling good.
Great, thank you. And Geraint, I hope I've said that right.
Yeah, hi. Yeah, I don't have a professional interest in this area. I'm just joining because I'm interested in learning more about it. I'm very interested in the outdoors and nature, and I've read quite a lot about things like forest bathing and more broadly how being outdoors and sort of just sort of experiencing it can help people. And I suppose I've just become more aware of this whole thing recently, so I thought I'd tune in and learn some more.
Thank you for joining us. And Imogen.
Oh, yes. Well, I think it's really, really nice to see so many people in the room at 6 o'clock in the evening. So hi, everybody. I work for High Life Highland. I'm the Countryside Ranger Service Manager. And we have a ranger in the room as well, who works in Ullapool. We've been involved in a few social prescribing projects, which with limited success, I have to say, unfortunately, but we're very passionate believers in this model, and really hope that we together we can kind of see something happen over on the West Coast.
Thanks, Imogen. Next, I've got Jenny Grant.
So I am that ranger Imogen was talking about. I cover Wester Ross as a High Life Highland Countryside Ranger, and yeah, we've tried some short walks and series a few times here, again with limited success, but a couple of folk coming. But really all we do relates to getting people outside and enjoying the outdoors and natural heritage, and it's really fundamental to what we do. And there's be a lot of stuff that I'm doing that would tie into active green health aims. So interested to know how I can help. If I can help, that's it.
Thank you, Jenny. I've got Justine.
Hi there. Yeah, my interest is in nature connection. I'm actually a certified forest bathing guide, and the last couple of years I've been running different workshops that integrate both being outdoors and art and photography. So running mindful photography workshops alongside forest bathing sessions. So my interest is definitely in the benefits of these nature connection practices, having seen how beneficial they are, and having gone into quite a lot of in-depth research on the various health benefits. Total advocate for anything that can be developed up here. So yeah.
Thank you. Kat, I know you joined a little bit later, but I'm sure you've gathered we're just doing some introductions at the moment. Would you like to introduce yourself? She's maybe not at the computer at the moment. Lisa, I've got you next.
Yep. Hi, everybody. Yeah, I'm a link worker with Velocity's Active Health Project, which is based in Inverness, but we work with people right across Highland, supporting them to be more physically active as a way of improving health and well-being. So the Active Health Project's in its 5th year of operation now, and we've had over, I think we're at like 1,045 referrals, I think. So we've been kind of working pretty successfully in the Highlands with using a social prescribing model. And I guess a lot of our conversations are around kind of sort of motivation and just kind of helping people to think about how they might benefit from being more active in ways that are going to suit them and their individual circumstances. So, and a lot of that is in well, I guess the thing that is most popular in terms of people's kind of chosen activity is walking, as it is the most kind of accessible and the most kind of aspirational, I think, even for those with quite limited mobility. So yeah, so very interested to be here and just see how this can be developed further.
Thanks, Lisa. 2 more to go. I've got Sandy.
Yeah, hi there. I'm Sandy Underwood. I work a day a week for the Community Trust, and my job there is to programme manage an active travel route which is proposed between Ardmere and Braymore Junction. So that's my job. As an extracurricular thing, I'm also looking at a project to put some mountain bike trails into Lisle Forest. I'm also qualified mountain leader, mountain bike leader, and just love all this stuff.
Thank you. And Tim, we've got you at the end of the list.
Yeah, Tim Gauntlet. I'm a director of the Community Trust, where we have tried to, in the past, establish a wealth and wellbeing a group. So I think we would like to get that going again. We also very much want to encourage all these different people and groups in the village and the community to work together. And this is, I think, an attempt to do that. And as a complete aside, I also run the local community cinema, attendance of which is always good for your mental health.
Fantastic. Thank you so much. I just want to echo Imogen's comments that it's so great to see so many people out this evening to look at this, and you're all bringing with you a real breadth of experience and knowledge, and it's a really nice mix. So before I go into the more sort of formal stuff about what the Green Health Partnership does and what we're hoping to start up in Ullapool, I wonder if Katie, you'd like to say a little bit around your aspirations around
Yep.
Your thoughts as a GP. Thank you.
Can I also put in a request, because I think that no meeting should ever go beyond an hour, that we try and roughly keep it to an hour. Would that be okay with everybody? That we
Absolutely.
try and so I think concentration and the stomachs usually grumble. Could I share my screen, Elsa? Would that be okay? I've just got a few slides. I won't
go for it.
kill you by PowerPoint, but there's some good visuals I think that might be helpful. So what can you see if I go on to slide? What can you all see there? Can you see my screen?
Yeah, we can see your screen in the next slide that's coming up.
So you can see that one. And so I'm not clever enough to know how to put it. So as long as you ignore the slide
On the right.
on the right, are
Yeah.
you okay to carry on with that? So
Yeah.
so I'm Katie. I've been involved with some social prescribing around green health for a number of years and worked alongside Elsa and Lisa. And I guess for me, it's a real passion. So I'm super excited to see so many people in the room. But why are we here, and why does it matter for health? And I guess for me, now, has that moved the slide on? Can you see medicine? Okay.
Yeah.
I think the big headline is that what we're medicine, the way that we were trained in the 20th century, was very good for 20th century medicine. But medicine in the 21st century is a very different beast, because we're living in a very different reality. And the two big dynamics that we're dealing with, which are closely intertwined, are on the left around social inequalities, a widening gap in social inequalities, which lead directly to health inequalities. And there's very strong data around that. So we're seeing the richer get rich, the poorer get poorer, and the health outcomes get worse, such that in areas of Scotland, you can have a difference in healthy life expectancy and even life expectancy of greater than 15 years just by postcode. But the other big pressure that we've got is around climate change and how we need to change how we practice. And I guess that we've been unleashed as doctors to be able to do this in our day job by the concept of realistic medicine, that we need to rethink how we're practicing. So if you start with the idea of first do no harm, which was the first tenet ever of the medical profession, well, I think that if we look at what we do now, we're increasingly realizing that what we do is extremely harmful. And it's not harmful just directly to patients. I think 1 in 10 hospital admission is quoted as being, I think it's that, Alice may correct me, as being directly related to adverse side effect from drugs. But we're increasingly realising, and that's work that's being done in the Highlands, Sharon Flegger's leading, around the environmental impact of medicines that end up in our water source. Not only that, but actually 5% of carbon emissions plus at least 5% are directly related to the NHS. And if you break that down, in terms of what the carbon footprint is, a huge amount of that actually relates to the medicines that we prescribe. So we've got a real challenge in health, is that we have to really rethink how we deliver health, because we know that what we have been doing is often very ineffective, particularly for mental health conditions. So, you know, the evidence base for antidepressants in mild depression is weak, and yet we prescribe these drugs a lot. That's just one small example. But so what we're doing is not only not very effective, but also actively harmful in places in terms of our environmental impact. But the good news is that the solution to this is a double-edged solution. So what is usually good for your health is also usually good for the planet as well. And that's around things like physical activity, contact with nature, increasing people's sensitivities to the green environment. And really key to this, in terms of starting to address some of the inequalities that are in our society as well, particularly around access to things like green spaces and some of those social determinants of health. Really at the centre of it is community, and it comes back again and again to the fact that to get some of these changes that will reduce health inequalities, we have to work closely with communities. So we have to step out of the consulting room if we want to start working in a way that's actually going to have an effect on health inequalities as a health intervention. So I think of social prescribing, that we use very loosely, as an intervention to try and address health inequalities, and that's why I'm excited to see so many people in the room. So I guess that was the context that I wanted to share, of why I think this really matters. But we are inventing this. The evidence base is still emerging, and it cannot happen without communities, because it starts in communities, and this is about us working closer with communities. So that's why we've got everybody in the room together, I think. Would that be a fair, Elsa?
Yes, thank you.
Any comments from Alice? Any gross inadequacies of what I've said? Inaccuracies?
No, not at all. I think it might be more actually in terms of medicines harm in hospital admissions, but yeah, no, I think that's really good, Katie. Yeah,
I think it's at least 10%. So we
yeah.
need to start doing things differently. And we also know that physical activity is, if we could have it in pill form, it would be something that we would be dishing out pretty much to everybody, with a few exceptions. So getting people active in the outdoors is a bit of a double whammy.
Thank you, Katie. I'm now going to share a few slides just to say a little bit about what the Green Health Partnership's been trying to do to help contribute towards this, and what we're hoping to do. And I'm saying hoping to do going forward because, as Katie said, communities are key to this, and we need community buy-in to really make this happen. So I'll just give some short slides, and then we'll devote the rest of the meeting to discussing it all and taking your views. So bear with me while I share my screen. Hopefully you can all see that now. There we go. So Think Health, Think Nature has been running since 2018 now. We are the work programme of the Highland Green Health Partnership. It's chaired by NHS Highland, but it's a cross-sectoral partnership that was set up as a pilot, one of 4 pilots in Scotland, to look at how we could connect people to the natural environment for their improved health and well-being. That pilot came with some centralised funding, but the funding actually ended at the end of September. However, the Highland Green Health Partnership really want to continue the momentum and pushing forward with the work that we've developed to date. So I'm really pleased to say that I'm still here and Helen's here, and we're committed to make things happen. I think the reality is that what we don't have now that we had in the last 5 years was the centralised funding from Scotland to make that happen, but we do have the staff support and we have ways and means. We've just reviewed our vision, and the vision is that by 2030, the natural environment is valued as essential for the health and well-being of the people of Highland. We will work together to support individuals and communities to connect with and enjoy nature while safeguarding our natural spaces and promoting inclusion and biodiversity. When we talk about green health, it can be take place, when we define green health, it's taking place anywhere nature can be engaged with. This can include inside the home, garden, a local park or a wild space. It can be active, such as walking or physical activity, but it can also be inactive, such as mindfulness and relaxation. And it could be part of an organised group, or it could be a self-led activity that people want to do. When we started, the evidence was showing that not enough people in Scotland were visiting the outdoors on a regular basis. The 2015 Scottish Household Survey said that less than 50% of adults in Scotland visited the outdoors on a regular weekly basis, and 14% didn't visit at all. The pandemic had a positive impact on this, in that probably the left-hand figure there has gone up. But what we're seeing is a more polarised impact. The people that weren't able to or had barriers to engaging with the outdoors still remained high. And so there's widening inequalities that's happening that we're trying to tackle. There are a whole raft of benefits from getting into the outdoors, and a lot of these have been summarised in A Dose of Nature, which is an evidence summary report by Exeter University, which has taken together all the studies, and there's constantly more and more studies happening, and summarise them in one place. And I'll share these slides with you if anyone has an interest, so you can click these links and read these. But as you can see, I won't go through the whole list, but there's a huge list of benefits that you can see down the left-hand side for our health and well-being. And just simply walking for 30 minutes briskly every day has huge benefits in reducing heart attack and stroke, diabetes, hip fractures, reducing the occurrence of bowel cancer, breast cancer, and depression and dementia. So as has been said, it's really good for us to get out there in nature. So looking at prescribing nature, this was one of the arms of the work that we delivered in the last 4 or 5 years, and we started pilot projects. And I'm really sorry we didn't get to the northwest, and we hadn't spent a lot of time working with you guys up in Ullapool. Highland is just vast, and we had to kind of pick and choose where to go. So we've done some pilots in Caithness, in Badenoch and Strathspey, in Kyle of Lochash, and in Lochaber. Looking at how we might prescribe nature, and we've learned an awful lot from those pilots. One of the things we learned was that there's an awful lot of barriers for people to be engaging with nature, and we've sort of summarised them into 4 themes, if you like. And they can be behavioural barriers, things like low confidence, fear of the unknown. They could be physical barriers like difficult terrain or the poor weather. They can be administrative barriers. If we're asking people to fill in too many forms and sign their life away, they get really put off taking part. And likewise for the activity providers, we don't want to create too much bureaucracy around what generally people are doing because they have a common interest in this. And then there's obviously financial barriers, big one in Highland being the transport costs, equipment costs, childcare costs, the costs of actually putting the activity on. So a lot of what we've done has been looking at how we can break down some of those barriers, looking at the audiences that would benefit the most from interaction. And we've tried different referral pathways. And there's 3 sort of summary types of referral pathways that we've looked at. The first is a direct referral pathway. This is where a health professional, in this example branching out, would be a community mental health support worker, would refer someone into a branching out programme, which is a 12-week mental health forest school type programme for adults. It's a very defined pathway. There are very limited spaces on that programme. The programme's very time bound. At any one time, we've got 2 or 3 branching out programmes happening in Highland. It's quite expensive to maintain, but the impact is very high, although the reach is quite low. The next type is the supported self-referral, which is what Lisa's working with the Active Health Project, where a GP or other health professional may pass someone on to a link worker who can have a person-centred conversation with an individual and look for activities in their community that might support their needs. The reach from that is higher and the impact is also high, and we know that it's reaching the right people. And unfortunately, we don't have link worker supports in every community. And so where in the absence of link worker support, we have self-referral, whereby we're basically signposting people to information. So we've developed a website at thinkhealththinknature.scot. We've got a directory of activities there and also self-led activities that people can work on. So we've got the model there, but now it's been sort of running for a good 18 months to 2 years. What we've discovered is that the reach of these programmes is very limited. The number of people actually opting to take up outdoor-based activities within these social prescribing programmes like link workers is actually very, very low. And when we were working in some of our pilot projects, the conversation came up that did we actually need to go through the health service for people to get the health benefits from nature? So a typical healthcare-led prescription pathway would have your GP pass an individual over to a link worker, and that link worker would then work with the individual to find an activity in the community. The model starts from a place of illness or crisis and is actioned only after professional help has been sought. And it relies very much on the healthcare professionals to be equipped with the information to persuade and encourage an individual to participate in nature-based activities and the knowledge of what's available out there. So what we started looking at in Lochaber was a model of more community-led approaches, where by community groups actually capture the people before they hit the health service, if you like. So it's called stepping stones. People are activity providers are sitting within this pool of knowledge, and that might be knowledge of mental health, knowledge of health inequalities, knowledge of what each other's offering and what the audience's needs are. But basically there's lots of activities people can engage with, and could we get community enablers to encourage and support people into those activities. And then through the activities, people are kept healthy and well and hopefully diverted away from health services for longer. And it's a bit of a bottom-up approach. So here we've got individuals who are taking part in activities, but if they feel like they need help, if they have a wobble, if their health takes a downturn, those offering those activities know where the support agencies are in their community that they can signpost the individuals onto. And then if an individual does need to go for professional help with their GP, physiotherapist or nurse, once they've recovered, they have first experience of nature-based activity, keeping them healthier in the community, which means they're more likely to go back to their health-forming habits at the end of it. So what we were proposing was that in the Stepping Stones model is that we'd like to try it out in Ullapool as a sort of a blended model. So we've got Katie and her colleagues at the health practice there who can do the top-down approach, the GP prescribed methodology, but we would like to work with the community to do the bottom-up approach as well. And what that might entail is sort of creating some local information hubs in the community, building networking opportunities between the different sort of stepping stones, the activity providers, maybe come and try events. We would try and define what activities are offered in the area. I know we've got our directory there on the website, but I know it's not complete and there's a lot more happening than what we know about centrally. Who might be our community enablers that could encourage people to participate? And who are the support services that we might want to make people aware of that are out there? We'd like to get some training as well. We'd like to do a bit of a training needs assessment to see if people would like further training to equip them to take people for health and wellbeing purposes, and also look at funding opportunities for sustained activities. So I'll just finish with an acknowledgement, really, that we know that most of the things we're asking people to do are voluntary-led, they're third sector-led, and we need to be supporting those groups with funding to enable them to do it. So the pilot in Kyle of Lochalsh has got off to a nice start in that we've been able to identify funding to support this work in that locality. And I think initially I'd love to open the discussion here to see how people in Ullapool felt about trying to deliver this model, and we can then collectively look at where we might seek funding to support some of those ideas that we've just put across. So hopefully that made sense. Welcome for any discussions and questions from all that. Yes, Anna.
I just, one of the statistics about how in COVID, generally, I would say I agree that the amount of people going outdoors increased in COVID. However, over the last 3 years, I was working with children during COVID and now afterwards. There is still an alarming increase in the amount of kids who have been going online and have become increasingly isolated in some of the more rural areas. And I'm talking about some kids who don't attend school, even if they live very close to a beach or, in theory, a wonderful river. I'm also seeing in our area in Wester Ross quite a lot of kids becoming less engaged with the outdoors, which is a surprise considering where we live. But I'd say it's very much what I'm seeing, that a lot of kids are spending too much time in their rooms, and that has become a pattern that's very difficult to address. And I spend most of my days encouraging, and I would say 90% of my sessions are outdoors with kids, and when I can get them outdoors and we can do things, that is always an improved outcome. But I'm aware that there are a lot more kids who we as a community in Wester Ross could be reaching out to, and also, more importantly, families, because there's so little social care in person up here. And I would say that's really, really important for Wester Ross, is it's people coming up rather than just, I know we're online right now, but it's the outdoors. It needs people to sort of do that. And obviously I know Jenny and myself, we're doing the best we can, but there is so much more need for support for families. Yeah.
Thank you, Anna. So that's starting to help define who sort of our need groups would be. Alice.
It's just a question really. I was at a meeting last week with the Whole Family Wellbeing Partnership. I just wonder if any folk are aware of that. It's a Maggie Hume, who's been seconded from Health Improvement, is sort of leading it in this area, and they're funded by the Scottish Government, but they're actually employed by the council, but they do have funding, and they're really looking at trying to put into a sentence what their remit is, but they're looking at what is it that families and communities really need for good health. And I was just thinking, gosh, I should have forwarded this to her, because this is really, what this is about. And we did a sort of workshop, and what came out of it was really talking about an information hub and a hub for people to get to, so that all, with real people contact about where, so people can find out what activities are on and what would suit them. So I was thinking that, and I don't know about, so then I thought about funding, whether they might have funding as well.
Thank you.
Funding, but I can send you details, Elsa. Or,
I know Maggie, because she was
yeah.
in our team, and I was at the launch of that Whole Family approach.
Okay,
but I wasn't so aware of the funding that was available. So that's
well,
also
I don't know.
very useful.
I might have got that wrong, but just made me thinking about, she did say they have funding until June 2025, and I don't know whether they may have funding that could go towards this, but I thought you might already know about that. But.
Thank you.
Yeah, there were several of us at that meeting a couple of weeks ago, and then obviously last Thursday as well. So I know a few people in this room are involved in that. So that's, a step in the right direction, especially as they actually came to Ullapool. So that's good.
It's great. It was so good. Yeah.
I'll just continue the thread then about who might be the people within our community who could benefit the best. We have a lot of profiles and public health profiles for the different areas, and there's different places we can look for this information, but it's always useful to hear from people on the ground who you feel would benefit the best. And we've had one example there from Anna, so thank you very much. Is there any other groups that are really a priority for anyone here? Yes, Katie.
I mean, I think there's a lot of issues in terms of disabilities and access to the outdoors, and I think that's a group of people who have disabilities that limit their mobility. So I think, I mean, it's hard not to think of all the usual groups that we think about when we're thinking about health inequalities.
I could maybe come in with a different hat on that I'd forgotten all about. But me and my husband run the Trishaw in Ullapool. I'm trying to remember what it's called. It's been so long I've been out in it. But we take people with disabilities out in the Trishaw. It's basically Katie, did you not used to run it in Inverness? What's it called?
I did,
Help me out.
Spokes for
Cycling
folks.
without age, isn't it?
Cycling without age. Thank you.
Yeah.
Yes, sorry. And it's it's functioning, but very loosely, I would say just now. We need to do a bit of training with people and get more people kind of confident in using it. But that is a facility that is around and could definitely benefit from more use and more pilots as well to do that.
Brilliant, thank you. And Sandy, sorry, I think I saw your hand up there and I interrupted you. Apologies.
Yeah, no, that's fine. You were saying that there's been pilots running in other parts of Scotland. How is all of this activity coordinated? Is this through a voluntary group, or is it something that's driven by the NHS, or how does it actually work?
So in Highland, the Highland Green Hill Partnership has about 16 different partners, and we meet quarterly. So that has the NHS, Highland Council, Highland Third Sector Interface, Nature Scot, Highland Environment Forum, Pass for All, some GP reps as well. High Life Highland are sitting on it as well. And so they've set the sort of strategic direction and priorities going forward. And then nationally, that was reporting to our Natural Health Service board, if you like. Now, the partnership is a very sort of top heavy, if you like. They set the strategic vision and everything. But what we found was to really make action happen, it's working in localities. That really matters, because we have to shape things to meet communities' needs, and it has to be co-designed with communities and have services that work with communities. So we've got some write-ups of all the pilots that we've done in the other areas that I'd love to share with you by email after this, so you can see the kinds of things that we've been able to achieve with other areas. We've also in the past given out small grant funding to try and support some of the community groups, and work with a number of community groups on applying to larger scale funding, such as lottery funding, or more locally the Community Mental Health funds as well, to try and support projects that are helping to tackle inequalities. And to date, we've supported over 60 projects in Highland with that. And I think we supported some up in Ullapool as well, even though we haven't managed to actually look at the referral pathway work in Ullapool too. I think what we found nationally is that the referral pathway, the social prescribing thing, the top-down model, has been incredibly challenging to implement in the 5 years that we've done it. So this is the first time that we're looking at more sort of community supported pathways, to see if we can get a better reach to the right people in the communities. Yeah, hope that helps, Sandy.
Yeah, no, I was just thinking specifically in Carl, for example, do you go through a community organisation? Do they organise the activities within that area?
So it's very variable. So in some areas, like in Kyle of Lochash, we work with the Development Trust, and it's great to see the Development Trust here. They had very, very few activities when we started. It's why we picked them as a pilot, actually. There was very little on the ground. So we trained up health walk leaders, and we trained people in branching out, and we worked with the Community Trust on funding applications to get skilled staff in to develop and deliver the activities. It was very different in some of the other areas. For example, in Caithness and in Aviemore, with lots of different groups and voluntary groups and organisations delivering different activities. So in Aviemore, we had the Community Transport Company, as well as the National Park, as well as the High Life Highland Countryside Rangers, the Therapy Garden groups, the Health Walk coordinators. And until we went in, there wasn't really a network, a way for them to share. But we developed what we call green health networks, and they have network lunches, and they'll be able to invite each other to try their activities. And they developed progression pathways between the activities. So patients whose needs were changing could move between the different activity providers. And we delivered a lot of training to them as well. So it's very much shaped around what's in that area at that time. There's not really a one size fits all approach.
Mm.
Jenny.
Yeah, just what you were saying there, you mentioned bringing skilled people in. I think, and this is just my opinion of the landscape of Ullapool. Ullapool's quite, I don't know if anybody else in Ullapool would agree, is fairly divided, and even the green language of, mindfulness, forest bathing, green health could put a lot of the people who most need it off. So that is a real concern of mine. And the other side, and sorry, this is very negative, I am very in support of this project, but I'm just bringing up these things, is the size of the village. Now, if we have some kind of referral service, whether it's top down or down up, then if I could very well know that person already. Now, are they going to be comfortable with, say, if I was leading some kind of mental health program, and I've come up against that before in Ullapool, where you don't particularly want a member of your community delivering that service for you if that's something you need. So that's what it was, just a thought of bringing somebody in who's not part of the community into the situation, which could help break down that barrier.
Yeah, that's a really good point. On the stigma side of things, I think one of the things we found over the course of the project is that the health benefits are universal regardless of your condition, and actually labelling services as a mental health service or a Parkinson service or a dementia-led service and everything, they have their place. The peer-led support things do have their place, but actually in smaller communities, just more general health, it doesn't even need to be labelled health either. It can just be fun, just a way to get people out. And we have used external services like Nature for Health, or an organisation that work across Highland, and they came in to deliver things in Lochaber for us. So that's definitely an option if we're looking at funding to get in external service providers to break down those barriers. Thank you. So Alice first, and then Katie.
Okay. Okay, can you hear me?
Yes.
Yeah, okay.
Yeah.
I kind of missed in the introduction actually to say who I was. So sorry about that. So I've been teaching yoga in Ullapool for the last 10 years. Before that, not in Ullapool, I was working as a counsellor in mental health, okay? And what Jenny just said, it just resonates so much. Like, and what Anna said, it just resonates again so much. It's in a small community, it's very, very hard to work with families or children who need, or anyone who needs mental health, and they need it. But if there's any funding available, please send it over to projects for children, what Anna's doing, or Jenny. Like when I was talking to Jenny, there's problem. She's organizing these amazing programs for people. They're amazing. I went to a few when my kids were smaller. It was brilliant. Now she can't go far because most of the people can't even afford the transport. Okay, now we're lucky in Ullapool. Everywhere you go, there is nature. You don't need to go far. But things like that are preventing. And I think the financial side is actually a very, very big issue. It's we can label stuff whatever we want, but as long as the people don't have the fun, like even now, and in yoga, I'm doing different classes. I'm working a lot with people with exactly limited mobility. Some of them try and never come back. Some of them carry on. But even for them, a lot of them, they are on a low budget. And I was already thinking today before this discussion, I was thinking, what can I do? So I decided I'm gonna do, let's say 3 times, 4 times a year. I'm just gonna run a free yoga session, just to get people there, just to get them moving. And these people don't need to necessarily, if they even go out in the nature, because all of them suffer with balance problem. They're quite fragile. I just run a seminar for people with osteoporosis. They're so fearful of falling or damaging themselves. So that could be done indoors as well, and if you empower them, if you help them with that movement and actually feel secure when they move, they will probably start going for walks themselves. But there were people, honestly, they're so worried because they have osteoporosis. And I'm like, you don't need to worry about movement with osteoporosis. Depends how you move. And if you're not moving, it has consequences. If you don't move, it's a vicious circle. Then other parts of your body are not going to function well. My passion is neuroscience. I've been putting neuroscience into my yoga sessions for last year. How movement impacts every part of our brain. Okay, how with movement you can prevent cognitive skill deterioration, dementia, lots of stuff. Even, we had discussion at Easy Yoga today about arthritis. Movement is the best help for arthritis, for example. But because it hurts, people tend not to move. They're not going to go on a trip in a forest, unfortunately. So if you you know, so that's one part, but mainly children. I would, that is an investment and in families, you know, and how are you gonna help them? How are you gonna find these people? How are you gonna, so the best, from my point of view and from my experience in mental health, fund the workers, you know, pay workers, they will find these people, they will work with these people, you know, like directly channel the workforce rather than a person who is a link to some other link to another link.
Yeah.
If you know what I mean.
So I think that's where the community enablers come in, and at a later stage we'll need to look at who those enablers are and how we can support them. Katie.
Yeah, Alice, you make some really good points there, particularly around transport. I think there's some really good data that shows that in areas where you've got high income, low deprivation populations living alongside patients with high deprivation, low income, those people do worse than in areas where they live in low income, which are high deprivation. So if you're poor and have multiple indices of deprivation, you live in an area where you're surrounded by people who are different from you in that thing, your health outcomes are worse. And I think that in small rural communities like Ullapool, when you talk about it being a divided picture, Jenny, I think that there's a real problem of us not being able to see deprivation quite so well and poverty quite so well, because it's not picked up by all the statistical methods that we have usually, like the SIMD score, but it doesn't mean that it's not there. So I think that those 2 points really resonated, and there's a real risk if you've got a culture, a predominant culture of sort of outdoors healthiness, of it being a real cultural barrier for people to partake if it's not part of their dominant culture, so to speak. Yeah. So I think there's some real, you know, what you were saying, both Alice and Jenny, really resonated with me. And I can't remember, was it you, Jenny, or you, Alice, who said about fun? I really think that none of this should be badged health ever, because health is totally off-putting. And actually, the outcome that we want isn't health. The outcome that we want is happiness, broader than just health.
Thanks, Katie. Tim, I'll bring you in quickly, and then I'll maybe summarise where to next in the last 5 minutes.
Yeah, I just find it ironic that we're talking about health and well-being, and we're all looking at small screens in the warmth of our own homes, and that itself is a problem in itself, I think. I just want to say, I'm thinking, what is the next stage? And I would start by saying there's actually an awful lot of activity that happens in Ullapool around this, small groups, larger groups, and actually it's a matter of, well, where do we go from here? I think actually we all do need to get together face to face. That'd be one thing. The other is actually identify. I think identifying need is the real key. And I just want to echo what people have already said. I think actually focusing on young people would be a fantastic way of focusing our attention and giving our time, because that's where the investment needs to be.
Thank you, Tim. So in terms of next steps, I mean, this was just the initial discussion. I'm hoping, because so many people have turned up tonight, that we're keen to explore this at Ullapool. And I think the next steps would be try to get us all together into a little bit of a workshop. We do actually have tools that we do which identify stakeholders and need and enablers and activity providers. I've got a bit of a desktop job to do, is to learn all the activities that are going on in the Ullapool area. I just wanted to have a quick question to you all about the scale of the area. And we've talked about the village, but how broad would we want this project to cover in that area? Has anyone got any thoughts on that?
I think, sorry, Jenny, I rudely didn't put my hand up. I think that a lot of the outlying areas like Achiltebui and Elphin, Dundonald, you know, everywhere in our community council area that the doctors probably cover, I'm sure they do, you know, those people, I don't live there, but those people probably do feel like everything's Ullapool centric. So I think it has to cover the whole area, really.
Great,
but you're going to need different people from different areas to be those champions.
Yeah, champions do help. Thank you. And Jenny?
Yeah, it was just a similar area, I suppose. I was just thinking the high school catchment, so that would take in Little Lochbroom, all the way into Coyach and Faculty Bui. So and Elphin as well. So quite a big area.
It also
but
covers Lochinver too, Jenny, but I don't know,
oh,
that'll
that's
maybe be a
true.
different,
Yeah, that's true. Maybe Lochinver's one step too far. But yes, that kind of area, I think, because that, I don't know if anyone else thinks that kind of works as a cohesive unit with the community. I'm just thinking about when I put on events or if I'm in schools, that's they're not different in the sense that people from Otby won't come to Ullapool, but people from I don't know, Braymore come to Ullapool. So it's keeps it quite contained in those differences.
Thank you. Helen, you got your hand up?
Okay, it was just to say actually that it's just great to start having these conversations, isn't it? Because I'm looking at this room and I'm seeing Jenny, and Jenny and I met many years ago at a branching out training course, and we ran a branching out course up in Inverness. We'd never met before, had we, Jenny? And we got together and we developed something out of pretty much nothing. But the thing was, at the time, there was 3 of us that did it, and we had an invested interest in being outdoors. I worked as an occupational therapist at the time at New Craigs, and I think if people are generally interested in what you're doing, then you can have that conversation and you get to meet each other and something will come out of it. And it depends what direction it is, but it's just nice to see, Jenny, because it just brings back that memory of just sitting around a table and thinking, right, what is it that we can do that hasn't been done before, but we'll give it a go. And we ran a successful 12-week program that was for people that were in the hospital. So it can be done.
Brilliant. I mean, I think that's the strength of all these local networks, isn't it? It's just, it generates the work. So I've got a job to do to find out what all the potential activities might be out there in Ullapool. And I don't want to put you on the spot, Christine and Tim, but you're in the Development Trust, and I'm wondering that you might be a nice central person that might be a good person for me to touch base with first, being that I'm down in Aviemore and I'm not in Ullapool. So I might get in touch by email after this, if that's okay. I'll share.
Then Bruce might be another person to get in touch with if we're looking at youth develop. He's the community. No, he's not. This is sports development. The active schools coordinator is what he is.
Thank you. He sent his apologies, and that's one of the persons I've recorded today for. So yeah, that would be great. So I've got a bit of a desk-based job to just pin down what the activities are, and I'll also start speaking to Maggie Hume about the whole families project and potential for funding. I'll always keep my eye on funding as we're having these discussions, but I think the next step will be I'll keep in touch by email with this group. If you want to stay in touch, that is. If you don't, just let me know and I'll drop your name off the distribution list. That's fine. But we can be starting to be a core group starting to form this. And in the new year, we'll maybe try and get a face-to-face couple of hours workshop where we can really sort of start to pin things down. Does that sound okay? Thanks everyone for turning up. 1 minute to go, so I've not held you too long. If you have any questions you want to ask, just drop me a line after this. You've got my email address, and I'll share the recording for those that didn't get to come. Much appreciated, everyone. Looking forward to this. Thank you.
Thanks very much, Elsa.
Thanks a lot. Okay, bye.
Thank you.
Bye.
Thank you. Thanks.
Bye.
Bye-bye.
Bye.
Bye.
Bye-bye.